Hello and welcome back to my channel. Today we're discussing endometriosis, a common but often misunderstood condition that affects millions of women worldwide. This condition occurs when tissue similar to the lining of the uterus, called the endometrium, grows outside the uterus. It can cause severe pain, fertility issues, and a variety of other symptoms that can significantly impact daily life. Despite being a common condition, endometriosis is frequently misdiagnosed or overlooked, leading to many individuals having to suffer for years before receiving proper care. Endometriosis can affect different areas of the body, including the ovaries, fallopian tubes, and the tissues lining the pelvis. In some cases, it can even spread beyond these areas, though that is less common. Unlike the normal endometrial tissue inside the uterus, which sheds during menstruation, the misplaced endometrial-like tissue has no way to exit the body. This leads to inflammation, scarring, and the formation of adhesions, which are bands of fibrous tissue that can cause organs to stick together. Understanding endometriosis is the first step toward getting the right diagnosis and treatment. Many individuals struggle with symptoms for years, sometimes being told that their pain is just a normal part of menstruation. However, severe menstrual pain, pelvic discomfort, and other signs should not be ignored. By recognizing the symptoms, seeking medical help, and exploring treatment options, those affected by endometriosis can find relief and improve their quality of life. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. The most common symptom of endometriosis is pelvic pain, which is often associated with menstrual periods. While many people experience cramping during menstruation, the pain from endometriosis is usually much more severe, often worsening over time. The pain may begin a few days before menstruation and persist throughout the period. In some cases, it can continue even after menstruation has ended. Pain during or after intercourse is another common symptom. This discomfort can range from mild to severe and may be caused by endometrial-like tissue affecting the pelvic organs. Many individuals with endometriosis report pain that lasts for hours or even days after intercourse. Pain with bowel movements or urination, particularly during menstruation, can also be a sign of endometriosis. When the condition affects the bowels or bladder, it can cause discomfort, bloating, diarrhea, constipation, or even blood in the urine or stool during menstruation. Heavy or irregular periods are another symptom. Some individuals experience excessive bleeding during their menstrual cycles, while others may have spotting between periods. These abnormal bleeding patterns can make it difficult to predict menstrual cycles and may lead to anemia due to excessive blood loss. Fertility issues are also associated with endometriosis. Many individuals discover they have the condition when they struggle to conceive. Endometriosis can lead to scarring and blockages in the reproductive organs, making it harder for an egg to be fertilized and implanted in the uterus. While not everyone with endometriosis experiences infertility, the condition is a known factor in many cases of difficulty conceiving. Other symptoms can include fatigue, bloating, nausea, and general discomfort, especially during menstruation. These symptoms can interfere with daily activities, making work, school, and social events challenging. Some individuals also experience chronic pain that is not necessarily tied to their menstrual cycle. The severity of symptoms varies widely. Some individuals have extensive endometriosis with minimal symptoms, while others with mild endometriosis experience debilitating pain. Because symptoms overlap with other conditions, such as irritable bowel syndrome or pelvic inflammatory disease, diagnosis can be challenging. Diagnosing endometriosis can be complex, as symptoms often mimic other conditions. Many individuals go years without proper diagnosis, leading to frustration and prolonged suffering. A thorough medical evaluation is essential to identify the condition and develop an effective treatment plan. Your doctor will begin by taking a detailed medical history, including questions about menstrual cycles, pain levels, and any symptoms related to digestion or urination. They may also ask about family history, as endometriosis tends to run in families. A pelvic exam is often performed to check for abnormalities, such as cysts or tender areas in the pelvis. However, small areas of endometriosis may not be detectable through a pelvic exam alone. Imaging tests, such as ultrasound, may be used to look for endometriomas, which are cysts associated with endometriosis. While ultrasound cannot diagnose endometriosis definitively, it can help rule out other conditions and identify signs of ovarian involvement. In some cases, magnetic resonance imaging, or MRI, may be recommended to get a more detailed view of the pelvic structures. The most definitive way to diagnose endometriosis is through laparoscopy, a minimally invasive surgical procedure. During this procedure, a surgeon makes small incisions in the abdomen and inserts a thin, lighted camera to examine the pelvic organs. If endometriosis is found, a biopsy may be taken for confirmation. Laparoscopy not only allows for diagnosis, but also provides an opportunity to remove or treat endometrial-like tissue. Because endometriosis is a chronic condition, early diagnosis is crucial. Recognizing symptoms and seeking medical attention can help individuals find relief sooner and prevent complications, such as severe scarring and infertility. While there is no cure for endometriosis, several treatment options can help manage symptoms and improve quality of life. The choice of treatment depends on factors such as symptom severity, fertility goals, and overall health. Pain management is a primary focus for individuals with endometriosis. Non-steroidal anti-inflammatory drugs, or NSAIDs, such as ibuprofen and naproxen, are often recommended to reduce inflammation and relieve pain. These medications can be effective for mild to moderate pain, but may not be sufficient for more severe cases. Hormonal therapy is commonly used to help regulate the menstrual cycle and slow the progression of endometriosis. Birth control pills, patches, or vaginal rings can help reduce pain and bleeding. Progestin-only methods, such as the progestin injection or hormonal intrauterine device, or IUD, can also be effective in managing symptoms. Gonadotropin-releasing hormone agonists and antagonists are another option for individuals with more severe symptoms. These medications reduce estrogen levels, putting the body into a temporary menopausal state and shrinking endometrial-like tissue. However, because they can cause side effects such as bone loss and hot flashes, they are typically used for short periods. I just want to take a moment to ask that you hit that like button and subscribe to my channel. Leave a comment below if you have any questions or topics you want covered in future videos. Anyway, surgical treatment may be considered for individuals with severe endometriosis or those who do not respond to medical therapy. Laparoscopic surgery can be used to remove endometrial-like tissue, scar tissue, and adhesions, which can help relieve pain and improve fertility. In some cases, more extensive surgery, such as hysterectomy or removal of the uterus, may be recommended for individuals who do not find relief through other treatments. However, this is usually considered as a last resort. For individuals trying to conceive, fertility treatments may be necessary. In vitro fertilization can help those with endometriosis-related infertility by bypassing the fallopian tubes, which may be blocked or damaged. A fertility specialist can help determine the best approach based on individual circumstances. Lifestyle changes can also play a role in managing endometriosis. Regular exercise, a balanced diet, and stress reduction techniques such as yoga or meditation may help alleviate symptoms. Some individuals find relief through dietary changes, such as reducing inflammatory foods like processed sugars and dairy. Support from healthcare providers, family, and support groups can be invaluable in managing the emotional and physical challenges of endometriosis. Because the condition is often misunderstood, connecting with others who share similar experiences can provide reassurance and practical advice. So, endometriosis is a complex and often painful condition that affects many individuals, yet it frequently is overlooked or misdiagnosed. The symptoms include severe menstrual pain, painful intercourse, irregular bleeding, and infertility, and can significantly impact daily life. Early diagnosis and proper management are key to reducing symptoms and improving quality of life. Although there is no cure, treatment options such as pain relievers, hormonal therapy, and surgical interventions can help manage the condition. Those affected by endometriosis should seek medical advice, advocate for their health, and explore the best treatment options for their needs. Thank you for watching. As always, take care of yourself and make the most of your day.